this middle-aged female, when she came up with her, she presented with small things like seizures, but they were very, very afraid. They had been to 4 different hospitals across the country before they came here, and they were panicked because they knew that from this small seizures which she was having, she would go on to develop generalized seizures, and that actually happened in the next 3 days. In the next 3 days, in the admission, from just the focal movements of the face and the arm, she went on to develop continuous generalized seizures, a term which we call status epilepticus. Status epilepticus is a life-threatening condition. In her case, it was a refractory status epilepticus. Despite giving 3 or 4 different IV anti-epileptic medicines, she did not have control. And it reached to such an extent that we had to paralyze her, we had to sedate her, and we had to put her on the ventilator. And she did not, her seizures did not get control. We needed to keep her on the ICU on ventilator for about a week. And once the seizures stopped, she was not conscious. And this state remained for at least 3 to 4 days, and overall about 10 days. It was very demanding from all of us. The relatives were also very anxious. There were people who had told them that you can take the patient home because in an elderly lady with status epilepticus, the chances of survival were meek. But the patient, the family, they persevered, they continued, they had faith in us. They had the option of going to other hospital where they could get all the bills reimbursed. But the faith they had in us, they were not ready to shoot the patient. Despite getting multiple advice from other people to take the patient home as he may not survive and they were unnecessarily spending a lot of money, the family persisted. They had a son in Doha, they had a son in USA, a daughter in Delhi. They all were taking turns and taking care of her. Her husband was perseverant. For a month, he did not go back to his home and he stayed there. And when we completed a diagnosis, what we found was it was anti-GAD associated autoimmune encephalitis. Autoimmune encephalitis is a very, very rare disease which has been found only after 2005. And there are only a handful of cases reported about anti-GAD anti-encephalitis. The exact guidelines for treatment are still not described in literature, but whatever information we have is only on the basis of handful of case reports. And we did that. We paralyzed her, we sedated her for a week, then we gave her IVAG. She required IVAG injections for 2 pulses, and then later on even more. But gradually she started to improve. Once she became conscious after about 15 days, she could not move any of her limbs. All her limbs were paralyzed. She had a tracheostomy, which is a hole in the throat to help ventilation. But she was a fighter, and we need to counsel her that a fighter always wins. Gradually, with time, with medications, with physiotherapy, she gradually came back once again. And it was nothing sort of a miracle. Yes, miracles do happen, but they require God's grace. And God's grace doesn't come on its own. It requires perseverance, it requires faith, it requires belief, and most importantly, it requires excellence and teamwork.
Patient Premkanta Kohli came almost, as I remember, 2.5, 3 years back to us. Uh, it was initially thought of a simple epilepsy like all usual patients. But then, as the case continued, the complexity came out. Under the guidance of neurophysician, the epilepsy was managed, further evaluated. She had also other comorbidities like diabetes, hypertension, hypothyroidism. Now, these were whenever the primary disease uh, fluctuates, it also affects the diabetes as well as the even treatment of the disease also affects the diabetes, hypertension. So in that way, there was active involvement of the team of physician also. Uh, Finally, the diagnosis was made that was autoimmune encephalitis. Patient had a long ICU stay, long stay in the hospital. During this period, diabetes also remained fluctuated. But that, with the God's grace, we were able to manage well without having any other complications. That initial management was done in the hospital, as well as later on it came to a patient came coming to us for periodic follow-up, and it was reasonably well managed. So finally, there was a happy end. The factors what we firmly believe which were responsible of our victory over the very complex rare disease with multiple comorbidities, of course, the blessings from the god. The second most important factor was a teamwork. It was very jointly tuned between the team of neurophysicians, physicians, ICU intensivists, physiotherapists, and other supportive uh, uh, medical paramedical staff. So that brought out a good victory. The other thing was availability of all the facilities and all the necessary investigation under same roof. So this also made the recovery smooth. There is across the hospital, it is a very good, positive, energetic environment. That certainly helps in the such complex disease for a better recovery. And of course, the trust of the patient and the family members in the institute, in the team of the doctors. We strongly believe all these factors were contributing in over the complete recovery of this otherwise a very rare and complex disease in an elderly patient with multiple comorbidities.
With a sense of expression to the divine that I would like to say a few words about the illness and recovery of Premkanta. Many diseases, many patients come to the hospital for treatment, but there are very few, once in a while, that they are so much challenging. Premkanta illness was really very challenging, and I must say that over the period of last few decades, the institution has risen to that level where it can effectively manage a case of such a complexity by committed teamwork, by availability of a very strong and detailed infrastructure, and finally, an attitude which keeps the patient at the center. Throughout the long course of the illness, we never lost sight of our final goal. It was a teamwork and the attitude of the relatives, their faith, their care for the family member cannot be adequately described. Finally, there is God in every patient, and whatever we are doing is to serve that divine. I must say with uh, happiness that the care provided by every member of our treating team in serving the true ideal of medical practice, this was a good example. And it will remain in the memory of all those who are involved for a long time to come. Thank you.